have a conversation with my mental health colleagues about what I've been learning from listening to our frontline healthcare colleagues who are working with COVID-19 patients. There are so many things that we as mental health providers can do to support and to provide the kind of backup for our frontline colleagues. But there also are things that we need to not do. And I think a great place to begin is what I've heard from so many frontline people is it's important for them to be able to tell their story, but in their own way, at their own time, and in their own pace. So we often think that when working with people who are experiencing stressors and traumatic stressors, as so many frontline healthcare providers are now, that we need to start with psychological first aid. And psychological first aid has a lot of positive aspects to it. It's got a structure, it's got a sequence that can be very helpful, but it's not necessarily the approach that we can take as therapeutic listeners with our frontline healthcare colleagues. So let's just step back for a moment and talk about what is psychological first aid. Well, it's intended to be a kind of a Band-Aid, but a psychological one. And the core steps really are a process that anyone with or without mental health training can do. And it's captured, I think, best by what I first saw almost 30 years ago in a disaster mental health manual. 3 steps: protect, direct, and connect. And to those, I would like to add a couple more. So protect is really first focus on safety. Are there safety issues? Are there physical safety issues? Are there psychological safety issues that the person you're talking to or the work team, if you're doing a conversation or a debriefing with the work team, are there safety issues that they're encountering right now that need to be addressed? It may not be within our power to address them, but we need to absolutely affirm them and make sure that there is some way, there are steps put into place so that the safety of the people we're talking to is protected. Then the next step is actually to detect, and that is really to do an assessment. And that's done in this context by listening, not by asking a whole lot of questions, but just simply by asking what's happening, what has happened, what are you anticipating is going to happen that is most challenging for you, that you're most concerned about, or that just is most important to you. And just by asking those simple questions and then listening very carefully, it's possible to get a really good assessment of what is immediately of concern to your colleague or colleagues. So the detect step really needs to come before any directions are provided, and even before giving directions after doing an assessment, I think it's really crucial to reflect. And by reflecting, I mean helping the people or person you're talking with to actually step back and just think about what they're telling you and think about what is going through their mind, what their feelings are, without necessarily asking how are you feeling, but just listening for the feelings. And reflection also is crucially an opportunity to reframe. So when you hear from a healthcare colleague that they feel really safe because they have all kinds of protective gear and their colleagues are very careful about that, but then you also hear from that same frontline worker that they're concerned because they're not sure that everybody's really carefully washing their hands for 20 seconds, and they may be rushing, and they'd like to see some kind of a reminder for people that they really need to take the full 20 seconds or have that 6 to 10 feet of social distancing. That is a signal that that individual is saying, I feel safe, but I also have some really serious concerns. I'm concerned about my own safety. I'm concerned about whether my colleagues are being careful enough to protect me, to protect the clients or patients we're working with. And I'm concerned that if we're not all taking all the steps possible, and even when we do, what we're exposed to could lead to danger for me, and then that can lead to danger when I go home to the people that I care about and my loved ones, my friends. So a simple statement like, I feel very safe, might seem like it's essentially saying, okay, nothing to worry about. So this is a person who's very resilient and they have a very positive attitude, and they do. And that should be taken into account, absolutely. But they're also expressing in the next breath a very legitimate concern, but they're saying only the tip of the iceberg. And our job, I think, is to hear beneath that tip of the iceberg and just notice that and pay close attention to that. And the reframe then is not to say, well, I guess you're feeling really scared, or I guess you don't really trust your coworkers, but of course instead to say, so being very careful and making sure that everyone does what they need to do to protect one another as well as protect those you're caring for. I can see how that is a really crucial goal and priority for you. And let's talk about the ways in which you're doing that, the ways in which you'd like to be able to do that, that maybe you're experiencing some blockages or some barriers. But let's talk about also how you are able to do exactly what you want to do, even if others are not always doing exactly what they need to do. And supporting those who are your colleagues, even when they are not perfect or when they are doing things that are not exactly at the standard that you would like. That's the big challenge. But again, not to prescribe that, not to say you've got to focus on that, you've got to pay more attention to safety, but more to validate that that concern is legitimate, and that the individual who's telling you that, they're not just talking about a fear or a concern or a sense of guilt or worry. They're also talking about how dedicated they are, how careful they're being, and ways in which they are actually accomplishing exactly what they want, because they feel safe because they know they're putting on their protective gear very carefully and they have guidance in doing that. So that's an affirmation that goes along with the concern that perhaps there are still ways in which I can't be as fully protected as I want to be. And focusing on that reframe, then we end up not just emphasizing the fear or the sense of sadness if there's a loss, or the guilt if there's a feeling of moral injury or having not completely fulfilled a responsibility, or just not being able to make things happen, like keeping people alive when it's just not possible. Not to focus just on that sense of distress, but to validate it, to not skip over it, and to affirm it as a signal of the core value. And then to look and listen for the ways in which that core value is actually being upheld by that same individual, even though they may be more focused initially on ways in which they can't uphold that core value. Yet there are going to be innumerable ways in which they are. Another great example from some of the healthcare workers that I've been privileged to talk with, several of them have told me that they have been locked out of their houses by their teenage children. And of course, they say that with a smile, but also a little bit of a look of bemusement and disbelief. And what they're really saying is that their children, who are old enough and wise enough to know that it's important to be very safe, have basically said, I'm going to take the lesson that you've taught me, Dad or Mom, and I want you to quarantine yourself. Now, whether that's exactly the right thing to do or not, that's not something that I can judge or that we should be judging. But the fact is that that's a stressor for that healthcare worker, because she or he then doesn't have the ability to just be home and feel relaxed and be with and be close to those that she or he cares about. And that may also be a challenge even if they are staying in the same rooms, because of the need to keep some sense of distance. But it's fundamentally an affirmation of what that healthcare worker has taught their children: to be careful, to make sure that everyone is protected, and that that they are able to be assertive enough and they have enough trust in their parent to be able to say, you need to do that, and I need to do that, and I need to take some control here. So in the midst of what could be just a stressful experience of I can't even go home and have my normal home life, which is very stressful and deserves our full attention and validation, there's also an indication of a contribution that healthcare professional has made by enabling her or his children to speak up for themselves, to take steps that they believe are necessary to protect themselves, and to engage their parent in doing that as a team, even if it means separation. So when you think about debriefing, then the reflection is really crucial, because we can't give direction in the sense of telling people what they should be doing. But we can give direction by finding the ways in which they're already doing what they believe is essential in order to accomplish their goals, and helping them to see ways in which they're doing that perhaps are just so second nature, or just are happening in the midst of so much else that they can't see. But maybe when they're able to just step back for a moment with us, they can see. So the direction that we give in a therapeutic approach to psychological first aid is not telling people what to do, what they should do. Those are good directions if they have to do with hygiene, if they have to do with other forms of physical safety, but that's not our primary job. Our primary job is to help people find direction by finding how they're already making choices that are actually helping them to achieve the goals that are important to them, often in ways that they hadn't even realized. And the connection then is the closing point for any psychological first aid. And the connection really, in a therapeutic sense, is who and what does this person need to feel a sense of closer connection to? Who are they saying that is important to them, that they'd like to be able to have more contact with, different kinds of contact? So a great example there, just one of many, was several of the healthcare professionals I've spoken to said that their children worry about them when they're at work, because they know that they're working with patients who have tested positive for COVID-19, often who are very ill, and they know that there are risks and dangers involved. And some of the kids have even said, I don't want you to go to work because I don't want you to get contaminated. I don't want you to be hurt. I don't want to lose you. And of course, that is not a choice that the healthcare professionals are likely to make unless there is some other very serious mitigating circumstance. So through their dedication, they're going to keep going to work. And there's nothing that we can tell them that would be a valid suggestion that they should back off and not do that. So in making that choice, then the question is, how can they stay connected with their child or their children who are worried about them? And some of the healthcare workers came up with, I thought, a brilliant idea, and I've heard this from several. They send pictures, or they do FaceTime, and they connect with their children, their spouses, other family members, sometimes their parents who may also be worried about them. They take moments during the day where they have a moment of quiet, not in the middle of the rush, not when there are critical incidents happening that might be frightening for their family members to see or hear, but when they have moments that are quiet, moments that are fairly normal according to their usual work routine, where places that they would go that would ordinarily be the case that aren't risky or dangerous, or moments where they just have a chance to take a break and step outside. And connecting with their family members in that way, where they can see one another. They can hear from their family members, they can see what their family members are doing, and their family members can see them and see what they're doing and where they are. Those moments, from an attachment security perspective, are absolutely vital, because those are the reunions, the reconnection. And that reconnection is a way of saying, I'm with you and you're with me in every moment. And most healthcare frontline workers are not consciously thinking about their family members in most of their work. They can't afford to. They have to be focused on the work, on their patients, on their colleagues. And yet in the backs of their minds and in their hearts, they are very much focused. And this is a way then to remind both them, the healthcare worker herself or himself, and their families. And again, it's not something to prescribe, but it's something to just reflect on and suggest, is that a possibility? Have you seen any of your coworkers doing that? And of course, one of the crucial barriers to doing that often is, well, I can't really take that time, because if I'm not on the job, if I'm not focused entirely without any breaks, then I'm letting my coworkers down, I'm letting my patients down. And there the connection that I think is really crucial is not that we should be the ones to say, oh, you need to take a break, you need to do that for good self-care. That's the kind of advice that isn't really very helpful, because it's so external, and it invalidates that sense of, you don't understand how I really can't afford to let down my guard. But the people who can give that advice legitimately are their coworkers and their colleagues, and sometimes even their patients. And so just inquiring about whether they've heard from others with whom they're working about how important it is to be able to take a break, so that you're at your highest effectiveness and you can do your job and be there for your patients and your coworkers with the fullest of your abilities. Have they heard that from other coworkers? Have they seen other coworkers who have had a difficult time doing that for themselves? Have they encouraged their coworkers? And very often they've said to someone else, you need to take a break, you deserve it. Just step back, reset. But they won't necessarily say that to themselves. And if they hear that coming from a coworker, or they remember how they've guided and supported a coworker in doing that, and that the purpose is to be effective, not just for self-care, that often makes the fundamental difference. And that's a connection then. To connect to your inner self and be able to reflect and meditate and just think through or experience a moment of peaceful quiet and notice where you are, that mindfulness moment. I don't think we can prescribe that, but we can find ways to help our colleagues to find those moments and to feel that they are able to do that, and that that is something that is part of their work, rather than that is something that they're doing in spite of needing to be working 24/7. So I'd like to just wrap up by suggesting, I hope some of these thoughts will be helpful. There are things I've learned the hard way, where I've made all the mistakes that I've just suggested, and it's taken me a good deal of time to figure out that the wisdom really comes from the people I'm talking to, and I'm a mirror and a listener, but I need to reflect what is often most difficult for that other individual to see. And when they can see it, then that's the solution, not my solution. And I think there are 7 things that we actually should be carefully listening for, and finding a way to reflect back to each individual or to each work group when we talk with them, when we meet with frontline healthcare workers. The first is just very simply, what is it that is their most significant concern? What are they most concerned about now? Their priority, their worry, their number one challenge at this moment. And then along with that, a second thing to listen for carefully, not to prescribe, but listen for, is what are the moments where they have felt most challenged? What have been the most challenging moments? Not the whole time, but just those moments where the stress has been greatest, the challenge has been greatest. And not to dwell on those, but just to reflect in those moments, what is it that has been their main primary goal? And that shifts the focus from what's happening to me and what I should be doing to what is it that is truly my priority. So that begins to connect those first 2 parts, the concerns and the challenges, and the moments of stress or challenge. Then those lead to a focus on what is it that is truly my fundamental goal in this situation. And oftentimes that's difficult to think through when you're trying to accomplish 12 different goals, but the fundamental goal usually is to protect, to preserve, to support, to show compassion, to be dedicated and not let others down, and really cover the backs of those who we're trying to protect and support. Those kinds of goals that are so crucial, whether they're at the workplace or at home. So, two things there: challenges and stressors, and then what is it that is the moment, or are the moments, when those challenges were most evident and most memorable, and what were the goals or the priorities, maybe the goal or the priority at that time. And then on the other side, to be listening for what were the moments that were most inspiring. Because I've heard so many healthcare workers say, there was this one moment where somebody did this, where I heard this from someone, where I saw this, and it just truly made me feel as though there was hope and that there are such amazing things that can happen. Again, it's not to try to in any way erase the challenges, the stressors, the amazing difficulties, but to balance that, the dialectic where it's also, there are moments of inspiration. And at those moments, I think it's really crucial to be able to reflect on what is it that individual has done in that moment or similar to that moment, where they've made the same kind of contribution and they've inspired someone else. Even though they weren't thinking about it in that way, they weren't trying to inspire anybody, but what were the moments where they were able to do something that was a contribution and made a real difference for someone else, a coworker, a patient or client, a family member, a friend. And taking those moments of inspiration, the ones that happen to us and the ones that we're able to actually create through our own actions, then that's also leads to what is the core value that inspiring moment and that contribution that you were able to make, what core value are you upholding and standing for? And how is that a core value that is really what you are carrying forward, not just in those moments, but maybe most evidently in those moments? So that's 6 things. 3 things on the side of the stressful aspects of these experiences, including stressors that involve loss, as well as those that involve threat or danger. And then on the other side, again, not to erase, but to just create a balance, there are the aspects that are inspiring, the contributions that people make without even realizing it, and the core values that they're upholding by being inspired and making those contributions. And if you can hear all of that and reflect that back in a 10-minute session, in a 50-minute session, in a 55-minute or 75-minute debriefing with a work team, the only thing that's left, point number 7, is a path forward. It's always crucial to be able to not prescribe, but to take from what you've just heard from that individual or those people. What is it that seems to be the logical, or one of the logical next steps that they're telling you is the path forward for them? Some action. It may be getting more information. It may be trying an experiment, something that they hadn't thought of. So let me give you one example of a path forward that a group told me, and then we'll wrap up. I was talking to a group of colleagues who are working in the intensive care unit. And one of the stressors that they experienced was that they often didn't get to know the patients who they were caring for, because those patients were on ventilators, they were comatose, and so in some cases they literally never got to know their patients as persons, and that was completely different from their experience. Even in an ICU, when there's so much technical concern and there's so much threat and danger, to be able to get to know the patient even a little as a person, for them to know you. And of course, having to wear the protective equipment, the PPE, that made it very difficult even if patients were conscious and they could communicate. So in talking about that and just focusing on the core value, which is that these healthcare professionals, they wanted to be able to know their patients so that their patients would know the compassion that they felt for them, in addition to all the technical things they were doing. And they wanted to be able to have a memory of that patient as a person, not just as someone for whom they did procedures. So they came up with a path forward. I would never have presumed to decide what that should be. They wanted to know their patients as people. They couldn't see them and they couldn't be seen. And so what they decided was that they needed to, and they have found a way to speak with the family members of their patients and get a picture with the family members' permission. A picture of that patient, sometimes with their family, but as they are as a person, not as a patient, not on a ventilator, not in crisis. And they've kept, and they now have a gallery of those pictures that all of them can see, so that they all are able to get to know in a sense that is really meaningful to them under these circumstances, each of their patients as a person. And that was the path forward that they chose. There are so many possible paths forward, and they all involve small steps that may seem like they don't make much of a difference, but that make a very big difference. If we can help the people we're talking with, the frontline healthcare workers who are our colleagues, identify what for them is a path forward, a next step they can take that could make even a small difference, then I think we've done our job, and hopefully there will be other chances for us to continue that conversation, although each of these conversations may be the only time that we have a chance to actually provide that psychological first aid and that therapeutic healing for our colleagues. Thank you for thinking about all of these possibilities, and I hope that you have many opportunities to provide the kind of support that I think we all want to provide therapeutically and just as human beings for our heroic frontline colleagues.